Once again, welcome to the masterclass. So today's topic is on future of health, Tap.Health's playbook for AI-powered chronic disease management. Chronic diseases like heart ailments, cancer, and diabetes are responsible for over 43 million deaths annually, accounting for 75% of non-pandemic related deaths worldwide since 2019. These aren't just statistics. They affect real people every day. The challenge isn't just treating them, but ensuring patients stay engaged and get the right care at the right time. AI in digital health has the power to make it happen by scaling personalized, proactive care like never before. And companies like Tap.Health, led by Mr. Manit here, are doing just that. Before we go further into the session, I'd like to introduce our team members. We have Mr. Kuze CM, who is the CEO of ProdWrks and CM Computing. CM Computing is our ProdWrks' parent company. And then we have Dina, who is the Senior Product Solution Consultant of CM Computing. Dina, over to you. Do you want to say a few words about CM?
Yes, I think, thanks, Manit. Once again, we have been associated with ProdWrks, and I think I could able to see many people who have attended the in-person event has also joined. I'm very happy and privileged Dr. Malik has also joined. Thank you, sir, for joining, and excited to learn from you, Malik. And we would like to host many events as we can to be and good product community in the Chennai and for the India. Yeah. Thank you, Janani.
So we have Harsha here as well, who's the co-founder and the editor of ProdWrks. Harsha, over to you. Please tell us a few words about our ProdWrks community.
Thanks, Janani. Thanks for making this happen, Janani and Manit. Really excited. I'll take exactly a minute because just like you, I'm here to listen to Manit. It's once again, it's great to see so many familiar names here, people from our past events and webinars. Thank you for coming back and supporting this growing product community. I'm Harsha, by the way, as Janani introduced. I'm the co-founder and editor of ProdWrks. We are a product community and a publication. So ProdWrks, we see ourselves as your voice, your platform, right, for the product leaders, product builders in India. For years, India was known as the IT services powerhouse, home to TCS, Wipros, the Infosys, you know it. We have been seen as the back office of the world, right? We executed ideas, body shop, built software that was born elsewhere. So, but we now see that changing, right? We are no longer just a services country. India is becoming a product nation. India is already a product nation. You look at UPI, no other country has built a payment system at such scale. Look at Zoho, Freshworks closer to home here in Chennai. And then there is the next wave of product innovators like Tap.Health, led by Manit. So ProdWrks, we exist to tell all these stories, right? Like not just to celebrate product leaders, but to get insights from how leaders like Manit are building, scaling, and shaping the future of products so that we can all, build better products ourselves, make India a product powerhouse, a space for, great product innovation. So we are able to do this once again, thanks to leaders like Manit, who's today sharing his playbook and lesson learned from building AI-driven chronic disease management solutions in Tap.Health. Thanks for listening, everyone. I just keep it short. Over to Janani and Manit. You can take it forward from here.
Thank you. So I'd like to formally invite our speaker. We have, on behalf of Team ProdWrks, I'm so honored to have a special guest who is a true innovator in this field. Please join me in welcoming Mr. Manit Kathuria, who is the co-founder and the Chief Product Officer of Tap.Health. He has been leading the way in integrating AI to healthcare, making significant differences in people's lives. Tap.Health is building trust, driving innovation, and making a real impact on people's lives through AI-driven chronic disease management. And Manit here has been so gracious enough to share his playbook for building AI-first healthcare solutions that work. We have an insightful session lined up with him, and I'm sure all of you are going to, greatly benefit from this masterclass. Without further ado, over to you, Manit.
Awesome. First of all, thank you guys. And good morning, everyone. Glad to see so many people here. It's great that we can share our learnings and the product culture in India is just growing, right? And I believe in like sharing knowledge and having an open conversation. So from my side as well, I'm super excited to share this knowledge and also open up some conversation at the end of the webinar where we could think collectively. So we'll keep that for later. So what I'll do is I'll just share my screen. Just give me a second. Let me know if you guys can see my screen.
We can see it, man. Perfect.
Perfect. Awesome. So we'll keep it super engaging. The idea is, I'll do a quick introduction on who I am, what is Tap.Health, what we are up to, what we are excited to launch, and then kind of dive straight into, how we are thinking through the AI-driven world of building products. How do we see the future going forward? How do we start thinking outside the chat box and really start building products with AI at core? And that's the crux of the whole conversation. I'll also share some learnings along the way, and feel free to ask me questions. We'll pause in the middle, so if anyone has any questions or want me to double click on anything, feel free to intervene. Um, Quickly about myself, I am a 3x founder. I have built, I've also led design across multiple companies such as Z5, Snapdeal, Instawork. I built two companies. One was in big data analytics. One was a company in the very early in the fashion space, which got acquired by Myntra, and then Snapdeal later on. Um, uh, yeah, I'm excited. I'm a designer by heart, by choice. I'm a musician by heart. Building products and solving problems is what I love doing, and here I am. I have been doing this for now over 18 years, and people. Healthcare to me is one of the most exciting, places to build in, and more on that. I think the way that we look at digital products today are actually going to get obsolete in the next 3 to 5 years. And how do we integrate AI at the core, and how do we truly build products that think, adapt, and evolve? Because that's what I believe is going to be the future going forward. A little before we dive deeper, let me first introduce you to the problem statement that we are married to at Tap.Health. See, over 350 million Indians live with chronic illnesses like diabetes, thyroid, hypertension. Most of them don't have access to affordable care, right? Traditional healthcare is very reactive, expensive. It's designed for hospitals, not for daily human lives. So that's what TapHealth wanted to flip, right? Our goal is to make chronic care extremely simple, affordable, and deeply personalized, all powered through AI. So TapHealth is solving this exact problem, right? For millions with the next generation 100% AI-driven diabetes management solution. This is the first product, that monetizable product that we're launching. It's going to cost just 200 rupees a month. That's going to be less than 10% of the legacy programs. So what makes us different, right? First of all, there's zero in human intervention. You don't need a human coach or doctor for the program. We have codified the entire thing with AI. Second, there is real-time, personalization that we are looking at. The program is tailored individually for every patient. And then the third piece is, how do we predict adherence and motivation drops? That's actually one of the core parts of what we are solving it with AI. Today, we can do a lot more in understanding human behavior and intervening with better products. With the power of Gen AI at our disposal, we are able to crunch a lot more data. So that's one of the exciting stuff. Um, so why, now that why healthcare, right? Why am I excited about as a product? And I'm going to take a very product view here, right? And I'm going to keep my entrepreneur and hat on one side. Just as a product designer, just as a product builder, healthcare is without doubt the most complex product space that I worked in, right? And the best part, and that's exactly why I love it. It's like literally a designer's dream for me, right? There's depth, there is emotion, there's behavior, there's psychology, and there are real lives on the line. But there's also a scary part, right? Bad UX actually isn't just annoying in healthcare, it actually kills. Almost 250,000 deaths, preventable deaths happen in the world, according to a John Hopkins study, because of bad UX. So, if I ask you guys, can you name an app with great consumer experience? Right from the top of your mind, someone may scream Swiggy, someone may say Zomato, someone may say Ola or Urban Company, but very rarely will someone come and take a name of a health or medical app, right? So that's healthcare in India so far is under designed, it's under loved, and it's waiting for product people like you and I to show up and shake things up, and that's what excites me the most, right? Healthcare is a blank canvas, and the way I look at it is that building in with AI in 2025 is Bitcoin in 2012. The next generation of billion-dollar health tech companies or companies that are leveraging AI won't just have good tech; they will actually have incredible AI-driven experiences, right? So yeah, I don't know if anyone has seen the show Cassandra. It's on Netflix right now. It's been trending. But I thought this image was a bit apt. When we like really look at when we rewind, right, for decades, when we look at AI, we've always imagined these humanoid robots, machines that walk, that talk, eventually will take over the world, right? You've heard of Skynet, you've heard of Terminator, and that's how the society has kind of, and the movies, the culture has ingrained the idea of what AI has been, at least in the early days, right? And then shows up Chat GPT, right? And then finally it does, it's no body, no glowing eyes, it's just a text box. But finally AI has shape, right? AI is something that now feels okay. Now I know what it looks like, right? And that's the first view of AI, a chatbot, right? The cool thing is it can reason, it can debate, it can reflect, it can plan, but it can also help us build, right? But then what's next, right? What how do we go beyond the chatbot, right? What does the future of um, you know product look like with AI at the center? And chatbot is just the early, I will call it, proof of concept, right? It's literally a dip in the ocean of what is possible. So I want to touch a little bit around on that stuff. So if you're building, to before I go deeper into that, if you're building products the same way you're building in 2020 to 2020, you're already obsolete. Products are not going to look like this going forward. So so what's changed? What's the turning point? How is 2025 different? Why am I so excited? All the rules have changed with Gen AI coming in. We are able to do things that we couldn't do 2 years ago. And I'm talking about the depth, I'm talking about the fidelity, and I'll show you some of that stuff. And I'm talking about how natural products are going to become going forward, right? So, natural language is the new UI, right? Users no longer need to adapt to your product. Your product will speak to them in a natural conversation. People can speak to it, and it will think for you. Voice will become one of the primary methods of input, and more than voice, it's conversational input, right? Where I just can speak, my feeling, and it should understand the context. It should be able to read between the lines. If someone is People rarely speak in one language in our country. If you come in North India, people may start speaking Hindi in some areas and will switch to Punjabi and will switch to some other language, right? And that's very common, right? People don't stick to one lingo. They have their own words. For example, in North India, we may say headache, but in Middle India, people may say something like "Mere sar mein gas chad gaya," which means I have. If you really translate that, it means gas in your head, but what it really means is I have a headache, right? So the way people use words, the way people talk is evolving. And can your AI, can your interface understand them? So at TapHealth, that was one of the biggest investments we did very early on. How do we build colloquial understanding in the medical field? before we even built our AI model, medical models, we actually built our natural language models, right? And we actually doubled down on understanding how humans interact and how do they speak, how do they communicate, because that's what will take us to the next level of building great interfaces, right? The next one is, we've heard about this stuff. You guys may have read. It's AI agents, is right. This is a big one. They're now trending hot. We are entering a world of AI agents where there is where AI agents are able to do complex workflows autonomously. Imagine, I come in and I tell the app, right, I want to manage my diabetes. It should be able to create me a custom health plan. It should be able to schedule lab tests, order relevant medications, adjust my diet recommendations, adjust my daily routines based on my adherence, based on my input. And this is not a future. This is happening right now. This is possible with today's technology. This is not something that is going to happen in 2027. Companies are doing it right now, right? And that's the beauty of and the power of how that's going to completely change the game, right? Again, this is a screenshot from one of our old versions of Tap.Health, but one of the things that we did very early was how can we actually use AI as a co-creator, right? Can I actually teach AI to design? Can I actually have AI build experiences in real time, understand context, and actually build information architectures dynamically, right? And that's what I believe, is the next wave. People designers and product builders only need to build the building components. It's like the Lego blocks, right? And then can you build a modular architecture that actually assembles everything in real time, right? And that's what we believe like is the future, right? Atomic design and modular architecture, right? Can you build the Lego blocks of a product rather than building the outcome, right? Today with AI, I can assemble UIs, content nudges, workflows based on in real time, based on users' condition, be it diabetes or thyroid, their behavioral patterns, their dietary preferences, their engagement streaks, psychological profile, right? Um, our our AI, for example, at Tap.Health, that we married our AI with the design system itself, so it's able to build, test, and iterate in real time with multiple permutation combinations, right? Without any human in the loop, without any bottleneck. And what it enables us to do is it enables us to build 10x faster than what it was possible even up to 12 months ago, right? We are able to build products at speeds that were unheard of, and that's the real power of being using AI at its core. It's not just about building a chatbot. How do you leverage it at every level of your product? And that's possible today with Gen AI, right? So how do you do real time personalization? Now there are two sides of the story, right? One time is, oh, I can build faster, but the other side that we look at is not can you only build faster, you can now, because now you have a lot more time, because you can build faster. AI can literally code modules for you today. You can build with a lot more depth and fidelity than ever before, right? Things I always joke, the best things that I always want is our P2s in my product roadmap. Finally, with the power of AI, I can reach those P2s, which were initially always deprioritized in a product roadmap, can actually now finally get picked up, because that's where the magic happens, right? In a product team, right? The P0s are always the basics, right? But P2s is where the wow moments are hidden, the wow experience are hidden, and most companies deprioritize them because they don't have time to build it. But now that excuse is gone, we are able to build much faster than ever before, right? Um, so, most people think AI is about automating tasks. Sure, that was like the phase one of it, right? But we are now in an era of adaptive intelligence, right? Where AI doesn't just execute, it adapts, it evolves, it guides. At Tap.Health, our AI coach doesn't remind users to just eat healthy or log meals. It actually adjusts the care plans in real time, it predicts dropouts before they happen. It nudges users based on their psychological profiles. It auto evolves. Every user interaction, every moment makes the interface smarter, makes the recommendation smarter, right? Every day it's smarter than the day before, and that's the beauty of adaptive intelligence, right? I'm going to show you guys a 4-minute demo of what we are now launching as the completely autonomous AI-driven diabetes management product, which we're now launching to the going to go launch to the world soon. But you guys will get a quick glimpse of what we have built, and it kind of showcases some of this stuff that I've been talking about. So I'll press play. If you guys can't hear the audio, then do let me know. Hi, this is Manit. I lead product and design at Tap.Health. I'm excited to show you how we are making diabetes management effortless. We have developed India's first 100% AI-driven digital therapeutics program for diabetes that is fully autonomous and requires no human support. Our AI continuously learns from your habits, lifestyle, and health parameters to personalize every aspect of care, including daily routines, diet, exercise, and even mental health support, all in real time. Let me show you how it works. It all starts with onboarding. Tap.Health uses voice and free text input to naturally understand each user's challenges and preferences. Our AI mimics a human coach by asking follow-up questions to refine insights. For example, if a user mentions struggling with portion control, the AI might follow up to check if this happens more at home or while eating out, or if it's linked to stress. With these deep insights, Tap.Health builds a personalized program that adapts in real time. From daily habits and diet to exercise and stress management, every element is tailored to the user's lifestyle, health goals, and glucose trends. Meal planning is one of the biggest challenges for people with diabetes. Following a diabetes diet often means eating separately from family, making it hard to sustain. Tap.Health solves this by adjusting meal plans to fit what the whole family eats. The AI suggests simple ingredient swaps, portion adjustments, and cooking modifications, making healthy eating effortless and sustainable. Beyond meals, Tap.Health provides full day guidance. Each morning, users wake up to a personalized health summary that includes sleep analysis, predictive insights, and tailored meal and activity recommendations. Exercise recommendations adjust dynamically based on fitness levels, glucose response, and activity trends. If stress is detected, the AI might suggest relaxation techniques. If the weather isn't ideal for outdoor walk, the AI recommends a guided indoor workout. Understanding why certain actions matter improves adherence. That's why Tap.Health creates personalized videos and content in real time, tailoring explanations to each user's unique needs. Logging meals is as easy as taking a photo. Our AI instantly analyzes nutrients, tracks calories, and provides real-time feedback. If you veer off course for a meal, the upcoming meals or activity levels are auto-adjusted to maintain balance without rigid restrictions. Tap.Health provides intelligent medication reminders, ensuring users stay on track with their prescriptions. Logging blood glucose is effortless. Users simply scan their meter reading with our AI help 24/7. It answers queries, provides behavior-driven nudges, helps troubleshoot health concerns, and offers proactive guidance. Each week, the AI coach proactively checks in, analyzing progress, identifying recorded glucose fluctuations, and asking relevant questions to gauge progress. Based on responses, the AI automatically updates the next week's plan. Users can check their meal adherence, activity levels, and glucose trends, medical adherence all at one place. They can also generate doctor-friendly reports that are instantly shareable via QR code, making consultations more data-driven and efficient. Tap.Health goes beyond daily management. It is designed for a long-term health transformation. The first few weeks focus on small, sustainable habit changes. Over time, the AI shifts towards education, deep analytics, and proactive interventions, ensuring long-term diabetes control. Tap.Health isn't just a diabetes app. It's an AI-driven health infrastructure. By integrating wearables, lab tests, and pharmacy services, it delivers fully autonomous, scalable chronic care management. All right. Yeah. So yeah, that's what we built, guys. That's not a concept video. That's live. It's currently under testing with about 500 users. But I wanted to kind of showcase of what it really looks like to build AI first products in 2025, and hopefully, you guys get some ideas and get inspired, and would love to also share some views. If you have questions, we can take it right now. We'll continue. We have a bunch of. I wanted to kind of take you guys through the playbook as well, on how can we really do this. So the base of the whole experience is that, can we build experiences a lot more natural, right? Natural language will be is the new UI. Can I just come in and I give an instruction like, can you book me a lab test for 4 p.m. tomorrow? And can a minute later I get an email and a message saying, oh, your booking has been done through Practo. Dr. Sharma is highest rated, and he is he's the best match for you. You made that decision, and that is already done, right? So can you actually simplify multiple steps and make something so seamless that it's almost like talking to a companion, and the action is already done before you feel it, right? Screen designs are going to go away, right? The idea that, oh, this is the checkout screen or this is the login screen, this is all going to go away, and is already going away, right? Fluid states are the new screens, right? How do I move from one state to another state? And things are going to become more fluid than ever before, and the fidelity of the transitions will almost feel seamless. You won't even know that you've gone through 20 screens. The user will feel, Array, I'm just on that screen only. And this thing has already happened. Everything will be so seamless, and it's already being built by a lot of companies, and that's the real power of what you can do today, right? So the idea is, can we build modular system and not rigid frameworks, right? Rather than hard coding components, can we actually build the building blocks rather than the final outcomes, right? Today, AI can, most of our, at least at Tap.Health, most of our products, information architecture is directed by the AI, which means that if a user interacts with certain features more, those features will automatically move up the ladder. If there are and higher on the screen, if there is a high intent for using a feature, that feature will pop up and move up the information architecture based on every user, every query, their history, their longitudinal data, what they're interacting with, what they're not interacting with, how are they using the app. If I'm not going to click on notifications, there is no need to send me a barrage of notifications. It should actually slow down the speed of notifications automatically, and actually should understand when should will be likely to click on a notification, and what kind of notification. And with data science and GenAI, we can do all of that. That technology is available today, right? It's about stitching it in the right way, right? Again, let one of the things that we really believe in is that we're letting the AIs decide not just the information architecture, but also the micro journeys going forward, which means what comes after, right? Let the AI decide, like, should be a recipe suggestion or should it be a motivational nudge? That flexibility and that modularity and that decision making, when you do leave to a AI based orchestrator, makes it extremely powerful, right? And that's the stuff that you can do today. The next one is like, let's not recommendations is a thing of the past, right? How do we automate outcomes, right? How do we automate complex processes, which means instead of just suggesting a meal, can the AI not just suggest it, but log it, calculate, adapt plans, schedule tasks, execute where it needs to be get executed, right? And come and gives the final outcome all completely automated, right? So it does the work for you rather than giving you cues for you to do that work. It goes like 2 steps ahead, and with one command you're able to, you get your recipes, you can get your groceries ordered automatically, you can get it could auto adapt based on if I like spicy food. So for example, imagine the world which we are building today, the idea of one recipe book fits all is gone away. I may like my food spicier, someone may want this food healthier, may want it sweeter, someone may want more sauce in it, right? All of that today can be understood through data, and I can actually build products that are exactly built for that one particular use case, that one individual, right? So the days of personalization is gone, and the days of individualization is here, right? How do we design for real-time adaptations? Let's say, you told me to take a walk in the morning. I didn't take a walk, and now it's lunchtime. Can you actually change my lunch diet recommendations and make it lighter because I didn't do my daily exercise? Or maybe I am traveling. Maybe I slept very late, and my sleep analysis says that I only slept 4 hours. And now you can't wake up in the morning and tell me to do a 1 hour workout. It needs to understand the context. It needs to say, hey, listen, I realize that you only slept 4 hours. Why don't, instead of doing the 1 hour exercise, why don't you do a 15-minute workout? And rather than going to the gym, you can do it right now in your home. And here's the workout. That's the level of adaptations that we have built at Tap.Health, and that is possible with today's technology, right? So the idea is, can we think in systems and not features, right? One of the biggest mindset shifts with building with AI is, can you, instead of thinking, how do you think in systems, right? A feature solves a single use case. A system understands context, adapts behavior, and grows with the user. So when we're building a Tap.Health, we don't start with, oh, let's build a meal logging feature. We start with something like, what system can understand the user's psychology, preference, behavior, metabolic patterns, and then evolve their health journey accordingly? So that's the shift from features to system is what the AI truly shines in, right? Systems are modular, adaptive, they're intelligent by design. They allow the product to reconfigure itself in real time. They unlock scale, they enable personalization, and most importantly, they make a product future proof. So as we are building with AI, ask yourself, are you designing that app that solves a problem in isolation, or are you building a system that learns, adapts, and solves at scale? Right? So AI doesn't just need tools; it needs ecosystems. And if you try to build those ecosystems right, your product will stop being a tool and start becoming more of a companion. So some food for thought, right? So what does the next big AI product look like, right? It doesn't, to us, the next $1 billion AI product won't look like an app, right? It won't have a login screen, it won't have a homepage, it won't even have a UI, right? Because AI doesn't look like anything. It doesn't have to look like anything, right? The best experiences are invisible, right? The products need to feel like magic. They need to be ambient. They need to be responsive. They need to be deeply personal. They need to work across multiple devices, across multiple modes, voice, text, sensor, cameras. The phone has so many sensors built into it, right? Can we leverage all those sensors today? Can we give more fidelity to our AI products, where it can see, it can hear, it can react, even your gyroscope, it can understand your movement, right? So the idea is, I believe in the next 5 to 10 years, the interface is only going to get disappear more and more. The UI of things are disappearing completely. What is now left is intelligence, and those who embrace, and that's how we need to kind of embrace the future. The winners of 2025 and beyond won't be companies that think of AI as a jacket or a add-on or a feature or a chatbot. but will start thinking about AI at the foundation of their product. So yeah, hopefully, guys, this was some insights I could share, and hopefully this was insightful. Open up for any questions. I would love to hear your thoughts on how, where AI is heading. I would love to hear your thoughts on how you guys are using AI with your products, so we can use this time to do that. And yes, if you guys, this is my LinkedIn. If you guys want to add me on LinkedIn, we're always looking to talk with partners, potential partners. If you're looking to invest, or an AI enthusiast who shares the vision, please reach out. Would love to always catch up and talk. So yeah, thanks for joining, guys, and yeah, let's go build the future together. On to you guys, onto the stage.
We now have the floor open for Q&A.
So I think the first one looks like from Siddharth. What are you using for AI in the back end? So yeah, we use multiple models. We have trained smaller models for specific tasks. So we have maybe about 9 or 10 models at work at any point of time, and models keep coming in, keep getting switched. Whenever either there is a better model, we also have our own fine-tuned models. There is no one size fit all. Honestly, AI is today a tool that you can leverage. There is no rule that you should only use GPT or Claude or Mistral. There is a model for everything. You can also build models fairly cheaply today. For us, it's a multi-model approach. So what's the source of data in the Indian context? Great question. I think data has been the core of course, building with AI. A lot of the data gets translated through initial human effort, right? We have, for example, if I just talked about diet, we had an army of about 20 dietitians working day and night for maybe 3 or 4 months just to build our first version of our diet recommendation. So it's moving in building there is a lot of proprietary data that gets built if you want to solve a very specific problems. That being said, not everyone has to do that. There is a lot of the latest models are constantly getting smarter on Indian context. So if you are a small startup or you don't have a lot of AI capabilities, it's not that you need an army of data scientists to build those data sets. Yes, if you're doing very particular specific things, sure. If you're building certain IPs, sure, of course, you need to do that. But for a lot of the basic stuff, there is enough intelligence that you could just start building with. And then, of course, as you start seeing what users are really, double clicking on or wanting more depth on, that's where you can start building your proprietary knowledge base models. And you don't need to train models. You can just build your RAG system. You can build your knowledge bases in a way that the AI, the open AIs, can easily leverage and give outputs from there. Yeah. Does it require, Clement, I think I'm reading your question. Does this need a CE certification? Yes, Tap.Health has been at the forefront of this. We were one of the first companies to apply for a license with the CDS. So right now the frameworks for a lot of these places are still work in progress. We are in touch with a bunch of people with the Niti Aayog. We're also in touch with people in the healthcare system. As the certifications are opening up and as there are rules around it, we are, of course, you have to build that trust. You have to build, be on top of your game in terms of data privacy, in terms of how you're handling the user's data, because this stuff may not be very, a lot of startups don't think of this from day one, but as a healthcare company, this has to be like in the top 2 or 3 items of your product roadmap. How do you use that? How do you store information? What kind of recommendations are you giving? Are you giving the citations? Are you explaining the science behind the why? Right? If I tell you to walk 6,000 steps. Why are you telling me to walk? Is there science behind it? Can you actually cite some of those papers, right? That's one of the early strategies we are using at Tap.Health. Then we are piggybacking on research done by large organizations and saying that, listen, we are not reinventing the wheel. We are just presenting the information in a lot more user friendly manner. The knowledge is standard or proprietary or large research knowledge that exists, and we're leveraging that, right? And that's what Google does. That's what pretty much anybody else who recommends. In fact, your doctor does that, right? And that's how we are thinking through in terms of building trust, right? Um, mm, mm, mm. I talked about data sets already. There is no one answer to build data sets. There is the data sets for some of the stuff, like especially in the Indian context, is you have to do it the hard way. There is no shortcuts around it. Yes, you can build some synthetic data sets in the early days to build a model fast, but if you really want to build accuracy, there is no shortcuts around it, right? How are social determinants of health considered in terms of design? For example, how does someone who has poor access to nutrition manage his chronic care with diabetes? Again, so this is where exactly the power of AI comes in. I can actually understand the user in so much detail just by their location, the phone, the language that they talk it, the way they talk, the weather outside, the AQI. There is so much information data that is there that you can actually leverage to understand what do I need to suggest. I can't be suggesting uh, a very heavy dish if it's 50 degrees centigrades outside. How do I understand the larger context? And that's the beauty of AI, right? We are able to churn a lot of longitudinal metadata in real time and then able to use all of that to give extremely powerful suggestions that actually are usable, right? The trick is not to give a suggestion, but the trick is to give a suggestion someone will use, or a recommendation or an action that someone will do, right? Otherwise, I can give you a diet plan with all the fancy quinoa salads and avocados in the world, and you're not going to eat anything. You're going to eat your paranthas, right? How do I understand what are you likely to eat? What is the next healthier version of what you're used to eating, right? Rather than me telling you, hey, listen, eat quinoa salad. That's nobody's going to do, change their eating habits drastically. And that's what we can do today with AI. We can understand them at a far deeper level than ever before. We've noticed in one of the diagrams that Ved was being used is that owned by Tap.Health. Yes, so Ved is our proprietary model. Ved in Sanskrit means doctor. That's the what we call the super orchestrator of Tap.Health. That's the intelligence that drives all the smaller models. So Ved controls maybe another 10 models below it, and then some of those models controls further. So it's a mesh of models, but Ved is at the center point of it. So Samsung, Apple launching their own health apps created with AI. Tap.Health is a complete tool. Yeah. So we are. I think these are all eventually, all integrations that we are doing. We are already talking to a bunch of these companies as well. And the beauty of it is that, a lot of larger companies have created frameworks for us to leverage that data, right? Apple Health, Google Health Connect. These are very powerful frameworks. So Tap.Health, just to FYI, Tap.Health was part of the Google for startups as well. So one of the large pieces was for us, how do we actually leverage the Google Health Connect data? How do we understand patterns a lot deeply and then build on those insights with our own proprietary engines? So yeah. How do you safeguard users? So that's something again that we built in Tap.Health. And if Tap.Health understands that if there's an emergency query, for example, if someone is having a chest pain, immediately the screen like stop goes, freezes, and it says go to a doctor, stop using Tap.Health, right? These are things that you have to build in your product, right? And that's what good product building is, right? You have to understand to build the safeguard. So it's not about building for the best scenarios. It's about building for the worst scenarios, right? Whenever I build products, I build for the edge cases. I don't build for the primary use case. Primary use case will happen. Edge cases is where you need to focus, right? Especially in health. How will AI motivate individuals if they lack adherence? Again, behavioral science today is available to the level that you will be extremely surprised. Gen AIs are one of the best behavioral scientists. In fact, they are apart from understanding. If I were to like rank it, understanding context is probably like the first what Gen AI can do, but then the next level is it can read between the lines like never before, right? And humans, we are limited by our repetition. Like, okay, do this. I have to keep telling you do this. But my way of communicating doesn't evolve. That's if hashtag your teacher, hashtag your parents. But with AI, I can actually hold the ear from the other side rather than telling you do this. I can actually explain you the why of doing it matters, prime you, and then make you tell you do this. And that's the beauty of how you can actually use AI to understand psychology, behavioral science, and actually build products that are a lot more human-like. Any other questions we have?
Hello, hi
Yeah, I
Manit.
think.
This is Prem here.
Hi,
Hi.
Prem.
Yeah, so I am the ex-CIO of St. John's Hospital, Bangalore, and I'm also an NABH digital health assessor. Okay.
Hi.
So, hi. So I have some questions. The first question is, what are the biomarkers you're considering for the diabetes? And how are you tracking it in your app?
Yeah, so I mean, without going too deep into it, that we are following. I mean, a lot of the biomarkers are either pulled in. So if there is multiple ways of input, right? Because that's the core of what we are doing. So first is manually. We have built a system where someone has to put in their, let's say, their glucose or sugar levels. Someone can upload their report, their last medical report, and we are able to analyze it and then pull the biomarkers that are relevant to a program. So our entire program is, of course, built on that entire methodology. If you have an Apple Watch or if you have a smart wearable or a CGM device, we are able to pull that data directly. We are also, but the idea for us was not to only build a system that's dependent on other hardware, but build it in a way that is accessible for the entire world or to the larger part of the 99% of India rather than the 1% because watch penetration, smart watches, all of that is very, very poor in a country like India. Yes, it's growing exponentially. Yes, it's growing by 20% every month. But still that number is nothing compared, like it's almost negligible still, right? So how do we, so, for us, it was always about building a system, so that's why we built stuff like you could take a picture of your glucometer and it would pull in its readings automatically through OCR. You could just speak through your voice, you could upload your report, and then as you continue connecting more devices, the fidelity and the accuracy of the system goes up exponentially. For us, it was never about giving medical advice. Again, we are not here to replace a doctor, at least at Tap.Health. We believe one of the biggest mistakes healthcare companies make is calling themselves the doctor and trying to replace the doctor. That's the mistake most people make. We are here as a behavioral change app. We are here to be a companion. We are here between your doctor consultations. And how do we complement the doctor? How do we complement the healthcare system? How do we complement in a way where we can improve adherence in patients? We can improve and outcomes through that methodology.
Manit,
So
I have
you're
a
not
question.
basically a clinical decision system, right? It is more of tracking the
Technically,
behavior.
we can be, but we are not delving into those waters yet.
Okay. So you're not going to.
When we do build for B2B and when we will have the licenses, yes, few years later, we have the ability to do it, but we have safeguarded our systems to not give medical advice.
So have you gone through this SAMD certification?
Yes, we are going through that in the process.
Okay, cool. So last question from my end. So the government is pushing a lot of these Ayushman Bharat initiatives, right? So wherein the health data can be shared to hospitals and so on. So where are you guys in that roadmap?
Yeah, so like I said, Ayushman Bharat is definitely ABDM is very much there on our on our roadmap. We have been in touch with multiple agencies within the government and have been working in building some of the solutions. The idea is we actually want to we are building this for the masses. Can we actually get this partner with the government itself and actually provide a large amount of India to our products? But it's still maybe for us maybe about 6 to 8 months away because our core focus so far has been only building the core product. But how do we build? When I start going to integrating with Ayushman Bharat, that's where my language grid and our ability to be multilingual uh, becomes far superior. So far, Tap.Health is available in 3 languages: English, Hindi, and English. But we have about 22 languages that we are going to launch in about another 3 months, which again, we built our own language models, which are now also going to get leveraged by the works of some of the large companies. But we built a very proprietary model. So getting that ready is once that is incorporated, then we can actually go out and blow this out into the large part of India.
Thanks, Manit. So it was a very good presentation and a very good use case as well. Yeah.
Awesome. Thanks, Prem.
Thank
Manit,
you
I have a
so much.
question.
Yeah. Harsha, I was
Uh,
about to put you on.
yeah.
He's been waiting with his
So
hand raised.
I wanted you to dive in a bit into the how the fluid design works in Tap.Health Money. Like how you are designing actually, because earlier you had mentioned during our call how you let Gen AI do all the work and you just put. Can you just dive a bit more deeper into that? I think that will be really helpful for the
Yeah.
audience.
So I'll two things, right? When I talk about just the for us product experience to me is 75% research, and then 15% about 15% like maybe building the building blocks, and then only 10% is just UI design, right? Whereas when we think of product design and product building, it's usually the perception is the opposite, saying that what does product building really mean? For a lot of people, end up being designing screens. But I think for us, it's about understanding humans, right? Understanding the needs. In fact, one of the beauty of what we are able to do today that I'm so excited that we were never able to do before is that AI has helped because of how we have built our workflows. We have a lot more time to do a lot more research. Where an average designer used to spend maybe 5 hours of research in a week is now able to spend almost 25 hours of research in a week. In fact, our team has some 5 full-time researchers, only 2 designers, but 5 full-time researchers. And then every single person in the company, including our engineers, including the marketing person, including the person who writes the content, is actually a researcher, right? And on a daily basis, we maybe talk to some 25 deep conversations with 25 users. We have done over few thousand conversations. Every conversation enlightens us, and that's the real power of building smarter and faster. People tend to believe that with AI, all you can do is build quicker, but you can actually build with much more depth and much more research than ever before, and that's more exciting, especially in healthcare.
Got Manit. And you had also mentioned that you don't build for features but for systems. So how does like the entire PRD itself evolve? Like how do you document what should be done? Like because it's so fluid, right? Like
Yeah, we ourselves, our process of the PRD itself is evolving so much. And there has been this whole huge wave of GPT generated PRDs that product managers have become lazy on. The days where I had to think of every user story line by line is gone. Now I just tell GPT to think of the user stories, it thinks, and the user is like, this makes sense. Okay, let me put it. But what it also does is it kind of makes you uncreative in many ways. So for us, our PRDs are nothing but our brain dumps, right? It's like how can we think of a system that connects into everything, right? Our conversations start from behavioral science, it starts from psychology, and it starts from the user needs and user goals. Then we build the product, right? And not the other way around.
Got it, Manit. Last question from my side. So when it comes to testing, right, like now the outcomes when it comes to a pure AI product, the outcomes can be countless. So how do you go about testing?
Yeah, so of course, testing is a continuous process. Like I said, there has been over 1,100 documented user tests, and I'm talking about detailed user tests that have already gone into building the current version of Tap.Health, and we have not even scratched the surface. So the number of users that we have actually a whole marketing team running campaigns just to recruit users on a daily basis. So we have a dedicated team of 3 people. Their job is every day to call user diabetics, get them onboarded onto our program, and then we bring them into the system. We do multiple deep short-term and long-term studies with them. This is a continuous process because our product is evolving so fast that the learnings have to come in even faster, right?
Thanks, Manit. I'll leave it to the audience now to, like pick your brain a bit more deeper. If anybody else has any questions, you can just unmute yourself and ask Manit.
Yeah.
Please
Hi.
go ahead.
Hi, Harsha. I'm Sahil this side. Hi, Manit. I'm Sahil this
Hi.
side. Great session, Manit. First of all, really liked your insights about building Tap.Health in general. I just wanted to kind of double down on what Harsha was just previously asking. So, for example, you mentioned about a complete flow diagram which talks about various modules and which can be required at different point in time, right? Maybe can you, as you said, that the PRDs have become more fluid, right? Like, how do you get AI to decide which module to kind of show first, which one to show second, the sequence of the different modules, and how to prioritize or deprioritize, different kind of marketing pushes or, lack of them, basically, given the current product ecosystem that exists, basically, right? So I was just curious in terms of how you kind of make things modular and fluid at the product level or at the screen level itself, basically, right? And how is like GenAI helping you on that? It'll be great if you can maybe zoom in a bit more on that.
Yeah. So, Sahil, great question, right? When we were initially building this modular architecture, we were giving it a lot of rules. We were saying, oh, red color means emergency, which means that, if you have a primary CTA, make sure if you're creating a component, don't stack 2 primary CTAs together, right? You can create this magic book of rules and regulations. And we were thinking, oh, we are going to teach AI how to, construct these experiences. What we eventually realized is we don't need to do that. Gen AI today is actually fairly smart in taking certain decisions. So what we learned from our life is that the more we empower the AI model to take decisions, and of course you have to put in your safeguards, you have to put in the do's and don'ts, obviously, right? Otherwise it will hallucinate, otherwise it may do things that you don't want it to do. Those are, of course, part of product testing, and that's a part of how you architect it. But the core decision making, you'll be surprised when you give it access to a lot of data, which means your databases are vector databases, and it's able to tap into every user behavior, every touch, every action. And when it's able to understand that, it will be able to create a far superior information architecture that you would manually be able to create. If you do a head-on-head game with the best product manager and an AI to construct information architectures, the AI will beat the product manager 9 times out of 10, right? But it's about giving access. It's about giving it the right rules and regulations, and not over spoon feeding it, which is what we were doing initially. It worked in building the initial versions, but then the more freedom we gave it over time, of course, the models have also evolved. I'm talking about when we started doing it was a year and a half ago. From there to now, what the models are able to do in real time for us is 10x. and it's what we the idea is how do we make it into a architectural algorithm rather than spoon feeding that this is how the page should look.
Got it. Got it. No, thanks for the insight, Manit. And just one more thing, a question I wanted to ask was that do you use like existing AI models like GPT, Claude, which you kind of feed data into, or do you make your own models to be able to kind of build an architecture like this? Because just curious on that as well.
You can build this on pretty much anything. Since we were accelerated by Google, we do have access to a lot of Gemini models, which we are also using for stuff like this. For this, you don't need any. It's not rocket science. Most good models are able to do an equally good job. It's about latency. It will come down to what are you also using the model for. Right? Because sometimes some models have multiple use cases. That's how we do decision making. We will also keep switching models. SNA, we're not married to a model. It's very much possible that after every month or 2 months, we may switch it for a newer model or a newer one that performs a lot better. Again, there is no rule book around what to use. This is all A/B experimentations from your side. But most out of the box models will be able to do what I'm talking about. This is not difficult for a Gemini or a Chat GPT or a Claude to do.
Got it. No, thanks a lot for your answers, Manit. Lovely presentation again. Thank you.
Awesome.
Thank you. Thank you so much. Does anybody else have any other questions?
Yeah, hi, Manit. This is Clement. So I had asked a few questions. I just want, I mean, this is more at a higher level. Where are you placed in your journey as a business? I mean, like, I know it's been about 2 years since you've started. Where do you see your direction of growth? I mean, is it in India or outside, or just wanted to understand that.
Yeah, I think, we truly believe in making in India and then building it for the world after. And that's been always been one of those things that, as a product and as an entrepreneur, I want more companies that go global out of India. That being said, the problem itself in India is so large. I think it's going to keep us busy for a while. And there is so much to be built. What we built is just 2% of what is possible, honestly. If someone can take my brain dump and build it today, it's literally like so much is possible. It's just so I think for us it will be get it right in India, learn, get it right, build, create value here, and then of course this is a product that can help even and that's why we built a completely digital product, because it gives you the flexibility to actually expand into other markets.
Yeah, thank you so much for that. I think you're on the right direction. I think I loved the presentation a lot. Thank you.
Awesome. Thanks, Clement.
Thank you. Thank you, everybody, for your questions. And thank you, Manit, for joining us today and giving us this incredible masterclass. It was great. I loved the session. And thank you, everybody, for joining us. And thank you for posting questions. And I think we can wind up for today's masterclass. Harsha, do you have any other final words to say?
Just a thank you to Manit, because I love this session, and more importantly, I love the questions from the audience. Like, it was very deep. And Manit, I think we need to do an AMA session next. But yeah, great questions, great set of questions, everyone. I thank you all for coming in and asking all these questions here.
Yeah, great. Thanks, guys.
Thank you. And sorry, before we wind up, I've just posted links of our upcoming in-person event. It's happening on April 5th in Chennai. So just click on the links so that you can understand more about the events. Please do show up. We look forward to seeing everybody there in person. Thank you.
Thank you, guys.